Welcome back. Thank you very much for staying with us. You're still watching Behind the Name, and I'm speaking to Dr. Maureen Allem here in Morningside at her clinic, Skin Renewal. So I just want to ask you just one more thing. So when you left with your little kids, right, 7-month-old daughter, and I don't know how old you said, 2.5 years old, your son, and you came to Johannesburg, right? How did he react at you choosing yourself?
He knew that he couldn't hold me back, that he needed to help me achieve my dreams as well.
Yeah.
He could see that, I'm a very type A personality with a passion for learning. And, living out there in the rural areas, I played bridge and I was doing a lot of things, but I thought, how am I going to do this forever? I need to actually fulfill myself as well. But being a mother, is a very fulfilling, role as well. And I just needed, and I was worried about, my father always begged all his children just to get, some degree or some kind of qualification to fall back on. And all I had was my BSc, really. So I really wanted to fulfill that promise that I'd made to him, that I was going to, finish and get some kind of profession that I could fall back on.
But then you worked at ER. That's a very demanding ward, right?
And our first job, I also had to work in ER, the emergency room. And then I finally graduated to the medical ward. So and I was very fortunate to have a mentor who used to work in the ICUs here in Johannesburg in one of the big hospitals. And he had to work under supervision, because many doctors have a addiction problem because they've got open access to all the drugs. So not many, but there are a few doctors who get hooked on it. So he had to work under supervision, and I had him at my disposal 24/7. So I ran a big medical ward of 60 patients. I was mostly with the females. Every now and then I'd have to run the male ward, and then you do ward rounds early in the morning with your consultant, which I had as my mentor, and he taught me everything about medicine. So it was quite amazing, and I worked 10 years in the wards. And then I also had to help in the renal unit at the Clarkstop Hospital. And I never forget, I had to come up every month to come and present to the transplant team here at the Johannesburg General. And when I had to have my thyroid out, one of my patients who's a surgeon said, you don't go to anybody else but this surgeon. And he was still working at the Donny Gordon. So I actually went to him, and I think he recognized me because I said to him, I used to present to you when I came up from Clarkstorp. To present all the renal, the renal patients on dialysis who needed a renal transplant. It's amazing how life works, how you meet up with people. You meet
up with the people who used to, definitely.
So he did an amazing job.
Full circle.
So I reached full circle with him, Docky Boerta. He was such a character.
But what do you think, Doc, about, you worked at a provincial hospital, you were in the ER, then medical wards, etc. And I
learned a lot in 10 years.
So especially because you were at a provincial level as well at some point at a provincial hospital.
It's now provincial, it's now a hospital. That whole unit there in Clarkstorp is a unit where registrars go to actually train to get their speciality. So I also had those doctors working at that time.
But you have experience of all these wards that are very demanding, and then you hear about medical negligence and people saying nurses are this or etc.
It was quite hectic, to be honest. It's quite traumatic. Sometimes in these, I won't go into all the details, but you get to you have to sleep at the hospital at night. So sometimes I bring my kids to come to sleep with me at the hospital. And that's why my kids never wanted to be doctors, because they saw you. They saw what you had to do, and then you get woken up at 1 a.m, come and resuscitate, and you get there and there's. Anyway, I won't go into that. So it's quite, it could be quite traumatic. I'm sure things have
and
improved.
Sometimes even breaking the news that you couldn't resuscitate. I always imagine that part of being
especially when you've got young kids and you try your best. Anyway,
sorry for taking
so I did 10 years of that,
yeah.
and I gave a lot back to the community. I gave of myself, and then I thought it's time for change because my son was coming up. He was matriculating. He was coming up to Johannesburg, and I didn't want him on those roads. And that's when I made the trek to Johannesburg to come back and do medicine.
All right.
No, to come back. No, I've done the medicine to come back and actually get involved in medicine again. And then when I started here in Johannesburg, I had to do locums. And
what are locums?
Locums is when, like, I had to go to exit medicals for mines. I had to drive to Boksburg and Springs. And so on a weekend, here I was doing exit medicals for mines. And then I also did locums doctor. So when doctors get incapacitated, like the one doctor that I worked for 6 weeks, he had a knee op, so he couldn't work. So I ran his practice, and then I also ran a practice here, actually exactly here where we were sitting. It was an old house here at Sandton Clinic, and I ran this GP's practice for 6 weeks. And I'll never forget, I kept having my MIMS in my pocket because, you know, we've got essential drug lists at the hospital. So there are only certain drugs that you can use. And coming into private medicine now, you've got a whole huge array and choice of medication. So I'd always pull my MIMS out to see if I'm getting the exact dose.
Yeah.
Blah, blah, blah.
Sure.
So
there's so much that can go wrong.
Yeah.
Your job is quite difficult, but also rewarding at the same time, I think, when you see someone heal.
Like
and
people, I'm turning 65 tomorrow.
Oh, you look great for that.
People, I've had a lot of help. Thank you, Skin Renewal. And people say, but when are you still going to work? Like, some of my patients, I built relationships, and that's what our doctors at Skin Renewal do. We build long-term relationships with our patients because we take them on a life-changing journey, a transformation journey. So we don't only renew skin renewal, we renew lives.
Yes.
One patient at a time.
Well, Doc, you'll renew my life. See, I don't have makeup on because I thought, you know what, I've heard a lot about Dr. Maureen and what she can do with your skin. So after this short ad break, I'll try and get her and convince her, actually during this break, I'll convince her to actually take a look at my skin to see what she can do. And then we talk a little bit more about her baby, which she founded, I thought, in 2005, but she's got an interesting story about that.